Hello everyone. Today we will briefly talk about acne problems. I remind you that I am not a dermatologist, so this is a simplified explanation that may be sufficient for many people because I provide quite a bit of useful information. So acne, everyone knows what it is. It's often red pimples, sometimes sensitive painful cysts that can leave that can be vulgar, simple acne or moderate or severe acne. It can ruin the lives of many people, and in fact, it often develops on the face. That's what is most well known. The forehead, the cheekbones, the chin, the cheeks, the nose. Of course, it can also affect the ears, behind the ears, the cervical region. It can affect the chest, the upper torso, and especially the back. That's very common. So, of course, there are different types of acne. We won't go into precise details, but the causes are also multiple. It can be hormonal, which is well known. We know very well that during adolescence, there is a testosterone surge in boys and the start of the menstrual cycle in young women, which can create changes and therefore inevitably have repercussions, can have repercussions on the skin and thus cause acne. This is called hormonal acne. Hormonal acne can also exist we see it notably in some women who, even though they are not pubescent, who are over 30, over 20, over 30 years old, sometimes with hormonal acne. It exists, sometimes late. We can also have acne related to a lifestyle that is not beneficial, especially those who consume a lot of sugary products. There is no proof, but there is often a tendency where those who have certain intolerances, especially to dairy products, it could worsen the situation. Basically, blood sugar that is very high in sugar, and then this might enhance acne a little. So eliminating sugary products generally, trying to eat healthier, staying well hydrated. Of course, this is not necessarily a single solution, but it's a lead. Then you have the common acne, sometimes related to touching small pimples often, very simply, and then touching them with fingers, which can feed the pimples, introduce bacteria, and cause inflammation. Among treatments, what I recommend at the very beginning is to see your general practitioner, to try simple topical creams that tend to dry out the skin a bit and reduce inflammation. These include creams with benzoyl peroxide, for example, which is very well known. There are combinations like Benzac with sometimes local antibiotics that work well, such as clindamycin, for example, minocycline. Other types of antibiotics are also possible. There are several therapeutic options, so we have quite a few choices. Then, there are also sometimes antibiotic pills to take for 6 weeks, depending. And sometimes stronger treatments, notably Roaccutane in gel form, which is also available and is more potent. You need to inquire about the details, but basically it's a treatment that must be taken over several weeks or even a few months to be truly effective. And when that's not enough, you often need to see a dermatologist because then the use of Roaccutane is really discussed. Oral Roaccutane has many contraindications and precautions, especially for women. So if you want me to make a video specifically about Roaccutane, its side effects, benefits, duration, and procedures, let me know in the comments and I will do it. Then, in some women with hormonal acne, certain pills can sometimes be prescribed, notably Diane 35, which is very well known, or its generic, which can sometimes really clear up acne. There you go. Among causes of acne I haven't mentioned earlier, since I'm talking about pills, in rare cases, some medications, especially certain estrogen-progestin pills, can cause acne. There are many other possible causes, but in any case, it's something that can be treated if you really have the motivation and desire. You just need to visit a doctor. All right, good luck. Have a good evening. Goodbye.